Hello, my name is Suzanne Craw, and I am the Director of Pupil Services. I am here today with Tara Webb, our head nurse. Today, we are going to review what you need to know about the COVID-19 health and safety guidelines. We hope you find the information informative and hope that it answers the many questions that you may have about the 2021-2022 health and safety guidelines Wyndham Public Schools has adopted. And just like last year, we are certain that things will change throughout the year. When they do, you will be notified. At the end of the presentation, we will also offer a town hall session to answer any outstanding questions. Attendance to the town hall is recommended, not required. I would like to take a moment to thank Tara Webb, our district head nurse, along with all the Wyndham Public School nurses who have dedicated a number of hours this past school year and summer reviewing the State of Connecticut Department of Public Health and Center of Disease Control's guidances regarding COVID-19. They kept Wyndham Public Schools in the wellness zone. If you see one of these members, please be sure to thank them for all their hard work throughout the last school year.
The district last year identified 6 guiding principles that focused our efforts as we reopen schools. Let's take a moment to review the guiding principles that will guide our work during the 2021-2022 school year. Safeguard the physical and emotional health and safety of our community. Provide frequent, accessible, and positive communication with all stakeholders. Ensure practical, student-centered, and fiscally responsible solutions. Ensure health and safety throughout the pandemic. Maintain active engagement in the community with strong communication and build partnerships with local and regional school systems. Ensure a clear focus on equity in individual circumstances. Leading with a vision of shared leadership, highlighting the talents of individual teams.
Wyndham Public Schools is proud of the fact that we have remained in compliance with all Department of Public Health and Connecticut State Department of Education safety guidelines throughout the last school year. The Wellness Zone campaign will continue to be used as a reminder of just how important each individual is to the collective well-being of our learning community. As we move through this presentation, we will go into more detail in how you can help Wyndham stay in the Wellness Zone.
The most important thing all staff, students, and visitors can do to keep us in the Wellness Zone is to stay home when not feeling well. We are all responsible in helping keep our school community healthy. This year, like last year, staying home when feeling ill, especially when displaying symptoms of COVID-19, is essential to keeping Wyndham Public Schools in the wellness zone. Keep everyone healthy by erring on the side of caution. And for those of you who have received the vaccine, we ask that you stay home when you're sick too. Just like last year, our school nurses will be available to support staff wellness. When in doubt, stay home until you have an opportunity to communicate with our nurse team.
The Connecticut State Department of Public Health is focusing on 5 key COVID-19 symptoms. If you have any of the COVID-19 symptoms listed in the table, then you cannot enter one of our school buildings. And in addition to calling out, you should and must contact your school's nurse. If you are feeling ill and you have 2 non-specific symptoms, please err on the side of caution. Stay home, call your school nurse, and get tested.
We are all responsible in helping keep our school community healthy. Please don't assume that someone else has already screened a visitor. This job isn't the sole responsibility of our secretaries. If a visitor is someone who will be visiting the building on a regular basis, such as a student, teacher, or intern, please be sure they know the expectation of completing the COVID health checklist each day before arriving. Also, be sure they have a copy of the health manual, have watched this video, and are familiar with all of our health and safety protocols for the district. Symptoms. What should I do? In our health and safety manual, we have a decision tree with common illness symptoms. Take a moment to review. In the meantime, let's look at an example. Should I come to work if I have a headache? Is a frequent question. Yes, you should Yes, you should if you have a known medical condition that causes headaches, such as a pinched nerve or you get migraines. As long as your headache will not interfere with your ability to perform your assigned duties, then you can come to work. However, if you have a headache and congestion, you may want to stay home, as you now have two nonspecific symptoms. Consult with a school nurse and consider getting a COVID test.
Staff should always report illness to our school nurses. If a parent lets you know that a student is out due to illness, make sure the school nurse knows as well. You may be the first to learn that a child is sick. The health offices and school secretaries will be collaborating to record students and their symptoms. Staff from Central Office and Early Head Start program will report to Wyndham High School's health office. Remember, if you do not feel well, please stay home. Contact the school nurse before coming back into the building. If you do stay home, please also remember to report your absence to your building administrator. Enter your absence into Kronos, and if required, request a substitute. These are all professional responsibilities of an employee. If you have had known contact with someone diagnosed with COVID-19, this should be reported to the school nurses as well.
If you are symptomatic or have had close contact with a person diagnosed with COVID-19, we encourage you to take a COVID test. Generations in Hartford Healthcare were leading the charge for this community. If you are looking for a test site outside of the Willimantic area, just visit the 211 website or give them a call.
Who should I call when I have a question? Any of our school nurses will be able to answer your questions. For the start of the school year, we have shifted some of our nurses. Nursing assignments will be updated on our website when we have changes. But these are the main contacts for the start of the 21-22 school year. Central Office and Early Head Start programs should contact the Wyndham High School nurse.
What are mitigating strategies? Mitigating strategies are the strategies that schools can put into place in order to reduce the risk of COVID-19 spread at their location. As scientists and our health leaders learn more about this virus, the mitigation strategies have been updated for the 2021-2022 school year. We will review each of the mitigating strategies listed above and note how these have changed over the past year. While we cannot eliminate COVID-19, we can do a lot to slow the spread and to minimize the risk of contracting COVID-19. That is why it is important for all of us to engage in the correct wearing of masks, physical distancing, 3 feet when feasible, hand washing and demonstrating proper respiratory etiquette, cleaning and maintaining healthy facilities, improving ventilation, contact tracing in combination with isolation and quarantine, and offer vaccine clinics to those who are interested. COVID-19 did not spread in the Wyndham Public Schools due to everyone's diligence in following all of the mitigation strategies. Let's do the same for the upcoming school year.
Mitigating strategy number 1, universal and correct wearing of masks. COVID-19 spreads mainly from person to person through respiratory droplets produced when an infected person coughs, sneezes, talks, or raises their voice. These droplets can land in the mouths or noses of people who are nearby and possibly be inhaled into the lungs. To reduce the spread of COVID-19, CDC recommends that masks be used by unvaccinated individuals indoors or by everyone in situations where vaccine coverage is unknown or known to be low, case rates are increased, more contagious variants are circulating, and/or other factors that warrant universal mask use. Everyone, regardless of vaccination status, will wear a face mask or a face covering while inside the school buildings due to the Department of Public Health and Connecticut State Department of Education's recommendations and current executive order that is in place. Face masks will be provided to any staff or student who does not have one or if theirs becomes wet or soiled during the day.
We are asking that your mask cover your nose and mouth. There is no specific style or brand recommended by the state, so choose whatever is most comfortable for you. The only thing we do ask is that you do not wear a mask with an exhalation valve or vent. These are not allowed in the school setting. We have included this picture because although everyone probably knows how to wear a face mask, we still see members of the community with their masks similar to the picture on the bottom. Regardless of the style of mask you choose, it should cover both your nose and mouth. We also have to remember that we will have students returning to a school environment in the fall for the first time. You will need to model and teach them how to wear a mask correctly the first few days of school.
We are often asked what type of masks should be worn in school. Wear a mask that has 2 or more layers of washable, breathable fabric, completely covers your nose and mouth, and fits snugly against the side of your face without gaps. Don't wear a mask that makes it hard to breathe. Don't wear a mask with an exhalation valve or vent. If a student or staff member comes to work with an escape valve, just let them know that these masks are not allowed in school and provide them with a face cover from the school. Also, it is best not to touch your mask, and if you do, wash your hands or use hand sanitizer to disinfect.
There are very few medical reasons a person would not wear a mask within the school building. Asthma is not listed as one of them. However, we do have students within the district that have mask tolerance accommodations. Please be sure to assume the best intentions if you see someone out of a mask and to address it quietly with a teacher or administrator. Any staff seeking an exemption must provide a note from their healthcare provider stating the reason and submit to Human Resources. A meeting with Human Resources must occur prior to issuing of an exemption. Our medical advisor or the recommending healthcare provider may be contacted to gather more information.
Certain situations will require staff to wear additional PPE. If you are working with students who are unable to wear a mask and cannot maintain adequate physical distance, a face shield or goggle will be required. There are other situations that may require the wearing of a gown and gloves. If you feel this applies to you, please reach out to your building administrator or school nurse to discuss the appropriate PPE requirements for your position.
Our second mitigating strategy is physical distance. 6 feet social distancing is still our starting point in determining close contacts and identifying those individuals at increased risk of contracting COVID-19. The CDC has determined that there are situations where having less than 6 feet is still considered low risk. The CDC created a quarantine exemption for students in school, and therefore the definition of a close contact within a classroom is 3 feet as long as everyone is wearing a mask. In this scenario, the risk of a student contracting COVID-19 from a classmate is low, and quarantine is not required for those more than 3 feet away from the identified COVID-19 positive student. This only applies between students and not between students and staff or between staff members. This exemption applies only in the classroom setting. For example, this would not apply during lunch or recess. Our goal is to have as much physical distance as possible while meeting the educational needs of our students. Although having more space is always better than having less, if having less than 6 feet or even less than 3 feet allows you as educators to better meet the educational needs of your students, then you may do so.
Mitigating strategy number 3, hand washing and respiratory etiquette. One of the best ways to protect ourselves from germs is by hand washing. When soap and water is not available, hand sanitizer should be used. Be sure to wash your hands before entering or leaving a room, before and after eating food, before touching your eyes, nose, or mouth, after using the bathroom, changing a diaper, or assisting someone in the bathroom, after blowing your nose, coughing or sneezing, after touching garbage, or after touching commonly touched items or surfaces. Last year, there was a focus on minimizing the sharing of common materials. This year, we will focus on frequent hand washing before or after the use of shared materials in an effort to minimize the spread of germs.
Staff and students will need to be reminded of respiratory and cough etiquette. Cover your mouth and nose with a tissue when coughing or sneezing. If a tissue is not available, cough or sneeze into your elbow. It will be important to dispose of the tissue in the nearest trash receptacle and to provide alcohol-based hand sanitizer where sinks are not available. If you or a student sneezes into your mask, the mask should be replaced with a clean one.
Mitigating strategy number 4, cleaning and ventilation. Windham Public Schools plans to follow the latest DPH and Connecticut State Department of Education guidance on cleaning and maintaining healthy facilities, including our school buses. The Department of Public Health shared that the COVID-19 virus is easily removed from surfaces when cleaning products routinely used in school. In fact, they even stated that we should focus on cleaning with soap and water-based cleansers and reduce the amount of disinfecting chemicals that were utilized. Therefore, baby wipes will be provided to each of the classrooms in addition to disinfecting products.
The district performed a great deal of ventilation work throughout the 2020-21 school year and met all COVID compliance recommendations from the DPH. The Facilities Department will continue to work with experts in the field to continue to maintain proper ventilation standards within each of our buildings. Tips to improve ventilation within your space. Keep outdoor windows open. Do not use a freestanding fan to circulate air. Instead, use a fan to exhaust air out of your room.
Mitigating strategy number 5, contact tracing. Our school nurses have spent a lot of time learning how to complete contact tracing. Contact tracing is used by state and local health departments to slow the spread of infectious diseases. Contact tracing will help the district identify and notify people if they have been exposed to COVID-19 and as a result should monitor their health for signs and symptoms of COVID-19. As a result of potential exposure, we may ask unvaccinated staff and students to self-isolate or self-quarantine if they have had a close contact with someone who has had COVID-19.
Last year, we all had the opportunity to learn medical terms. These medical terms are essential, and it is important to know the difference between isolation and quarantine. A person would go into isolation when they were diagnosed with COVID-19. An unvaccinated person would be asked to quarantine when they've been exposed to someone who has tested positive with COVID-19. Travel restrictions may also recommend a person to quarantine.
Families and staff members will be notified by the school district if they have been identified as a close contact to a student or staff member who has tested positive for COVID-19. Notifications are made in a timely manner after the district receives the documentation from the local health department or notification from staff and or family of a positive test case.
On a daily basis, the Windham Public Schools updates the COVID-19 dashboard found on the Windham Public School website. If you are interested in the number of staff or students in quarantine or isolation, please check out this website.
I want to thank Tara Webb and Kristen Gooden for their dedication to keeping Windham in the wellness zone and leading the school nurse team through the contact tracing process. Contact tracing isn't an easy process, and I can assure you that this team leaves no stone unturned. Thank you all. While during the summer months there were limited cases of isolation and quarantine, we expect these numbers to look different in the fall. It is important that you practice a layer of mitigating strategies to keep Windham's environment free from COVID-19. Mitigating strategy number 6. Windham Public School plans to continue its extensive efforts to support students, families, and staff in finding vaccination opportunities through its bilingual family liaisons and ongoing communication. If necessary, Windham Public School will once again collaborate with Hartford Healthcare and the North Central District Health Department to coordinate vaccine clinics in support of our students, staff, and family. This summer, we hosted 2 vaccine clinics where we were able to fully vaccinate over 30 individuals from the community.
Windham Public Schools has created a compliance feedback form to ensure the district's compliance with COVID-19 safety procedures and protocols. Any staff member can submit the Windham Public Schools COVID-19 compliance form found on our website. The health office will run differently again this year. We will need to think back to mitigating factors for decreasing the risk of COVID-19 spread. We want to ensure that sick children are separated from routine health visits. Therefore, we will be asking staff to address basic first aid within the classroom and to try the strategies above before calling the health office. Please always call down to the nurse before sending a student. We will not have isolation rooms. If there is a symptomatic student in the health office, we may want students requiring routine health visits to wait or to be seen in an alternative location. A staff member should always call to the health office before sending a student. This will help ensure proper social distancing can occur and the nurses can be notified of potential symptoms of COVID-19. Students may independently ambulate to the office for a variety of individual needs, so long as none of the following symptoms are present. In case of an emergency, calling 911 should never be delayed. Staff and families should report any upcoming international travel before returning back to school or work. We also encourage everyone to review the latest guidelines prior to any travel outside the state of Connecticut.
As we shared earlier in this presentation, and want to highlight again, if you are sick, regardless of your vaccination status, stay home. If you are not vaccinated and have had close contact, please stay home and contact your school nurse. All COVID-19 test results, positive or negative, need to be reported to the school nurse. Central office and early Head Start employees will report to Windham High School school nurse.
Our school nurses are prepared to help staff with the return to work guidelines. We encourage staff who have any of the 5 key COVID-19 symptoms to get a COVID-19 test and to inform your medical providers. Staff who have COVID-19 symptoms should plan to self-isolate for at least 10 days since the onset of symptoms and until at least 24 hours have passed with no fever, with or without fever-reducing medications, and with improvement in other symptoms.
Again, we encourage staff who have any of the 5 key COVID symptoms to get COVID-19 tests and to inform your medical providers. Staff who have COVID-19 symptoms and have had a close contact with a person diagnosed with COVID-19 should plan on self-isolating for at least 10 days since the onset of symptoms or until at least 24 hours have passed with no fever, without fever-reducing medication, and with improvement in other symptoms regardless of the test results. The Department of Public Health is erring on the side of caution for the benefit of all staff.
If you are fully vaccinated and have proof of vaccination, you are not required to quarantine after close contact with an individual who has tested positive for COVID-19, as long as you do not have any symptoms. The CDC recommends diligence in mask wearing inside and outside of school and to closely monitor for symptoms for 14 days, as well as testing between days 3 and 5.
Unvaccinated individuals will need to quarantine when they have had close contact and are symptom-free. An unvaccinated individual can test 5 days past exposure. If they receive a negative test, they can end their self-quarantine after day 7 and monitor for symptoms through day 14. Individuals not tested will remain home in self-quarantine for 10 days from last exposure to the person diagnosed with COVID-19. If remaining symptom-free and can continue to monitor for symptoms through day 14.
For those of you who were with us last year, 90% of this content was the same. We were so successful. Keep doing what you did last year. But if you are new to us and you are feeling overwhelmed, all this information is written out in our Health and Safety Manual for Windham Public Schools, posted on our webpage under the Staff tab. If you have any questions about any of the content, just ask a school nurse. If they can't answer the question, they will find someone who can.
Thank you. Thank you for watching the video today. As always, if you have any questions, do not hesitate to ask. It's better to be safe than sorry.